Hello, and welcome to the Dissidents Podcast, where we talk about how we can strive for a world in which freedom and reason are at the forefront of all human society.
Welcome, everyone, to the Pro-Social Podcast. We are joined here today by Andrew Hartz of Open Therapy Institute. Andrew is the founder, president, and executive director of the Open Therapy Institute. He's also a practicing clinical psychologist and was formerly a professor in the clinical psychology doctoral program at Long Island University, where he also completed his PhD. He completed his clinical internship at Columbia University Medical Center, and he also completed training at Mount Sinai Hospital and the William Allenson White Institute. For several years, he's written about political issues and mental health for outlets such as the Wall Street Journal, City Journal Discourse, the Federalist, Real Clear Education, Heterodox Academy, the New York Post, and Quillette. He's also been featured in the New York Times, on the Dr. Drew podcast, and on Dr. Phil Prime Time, as well as in the Free Press. Andrew, it's a pleasure to have you on.
Thanks for having me.
Absolutely. So today we'll talk about Open Therapy Institute, specifically the overlooked issues in mental health care. And as we mentioned before, prior to hitting record, organically, wherever we end up, we end up. But I'm curious to learn from you. What made you want to go in this direction with your practice and public presence?
I had a number of experiences through my training that kind of increased towards the end of my training. I finished my PhD in 2019, and towards the end, I was just seeing the training become increasingly politicized. Weekly, bi-weekly, multiple times a week, lectures, almost always focused on identity politics. Dialectical thinking was pretty much implicitly forbidden on those topics. You had to totally agree. You could not think there were any costs or risks or alternate perspectives on the issues presented. And a lot of them had an incredibly high degree of aggression in them. Certain demographic categories were insulted, demeaned, invalidated, really targeted, and then other identity categories were really idealized, often in like a grandiose way. And I just thought the whole thing felt very unhealthy for training, but also I was very concerned about how it impacted patients. And then I was thinking, as I was going through that experience, I was in psychoanalysis during my training. I luckily had a therapist who really helped me get through the challenges. But I thought about people facing similar types of experiences, if they're college students, even like some attorneys, people working in the entertainment industry, who would be similarly feel antagonized, and where would they find a therapist who might be supportive? Where would they get support? And could they find that person? So I was kind of, so it's kind of this weird thing where I was recognizing that at the same time, lots of people are having this experience and feeling attacked for their beliefs is the time when the profession is, rather than finding ways to help these people, actually compounding the problem and engaging in the exact same behaviors. And so when I looked around in grad school and I was like, there were no organizations in mental health at all focused on bias, focused on any of these issues. And so I wrote an article for the Federalist, actually, where I just outlined like there's nothing here. There's no training. There's no research. Like there's nothing. We have to build all these institutions to do all this reform, and we really need them. That led to a series of grants and creating the Open Therapy Institute and articulating the problem more precisely. This might be a little bit of it sounded initially like a little bit of a tangent, but we were really careful with how we defined the mission of the Open Therapy Institute. And I do think people sometimes struggle with our mission because we we try to confront bias by documenting issues in patient populations that are underserved because of bias. And that's, people pause a little bit when they hear that. It's a little bit hard to wrap your head around. And I know that people are kind of like, it's a lot of words. Originally, when we started, there was I think that a lot of people were saying, well, the goal should just be therapists shouldn't be biased. Therapists shouldn't be activists. Let's just say that and leave it at that. That's an easy thing. But I felt that it would really be underselling the problem. And it would set us up to be an organization that just kind of repeated a slogan. Don't be biased. Don't be an activist. Don't do, it didn't really go anywhere. And I didn't think it was going to actually be successful at addressing the bias or building a dynamic professional movement that's really confronting bias and helping these patients. So we were like, what really needs to happen is we need in a clinical and intellectual project to really look carefully at what are all our blind spots, who's not getting served and why, where are we getting things wrong, and we need to start cataloging those issues and messaging on those issues and training therapists on those issues so that we have this kind of dynamic intellectual project that we're all engaging in, where we can do work that complements each other and people can develop specialties on different populations, and we can start to really have a vibrant movement that confronts bias, not just repeating a slogan and not limiting it to the worst case of the clearly activist therapist, but really thinking about bias in a much broader way. And that led to us creating our journal and our workshop program, which is all about looking at, look at like poor therapy for gun owners, or what about abortion? It's like an issue that people feel things about and therapists might mishandle. Religion, masculinity, racial issues, self-censorship, just starting to unpack all the ways sociopolitical issues come into sessions and that therapists might respond with bias. And so we really, set up the mission. It still doesn't roll off the tongue, addressing issues that are under addressed because bias. It's not a great, soundbite, but it's really important that the work have that kind of focus towards cataloging this work and not be, narrowly defined as just like condemning a certain faction of the field.
Yeah, could you tell us a little bit more about the journal as well as the workshops that Open Therapy Institute has?
Yeah. I'm incredibly proud of the articles and workshops that we've been able to get together. And we have like kind of an unbelievable faculty of multiple people at Harvard and Yale and Columbia and other great schools, NYU. It's a really top-notch group. We got Jonathan Shedler. We've had some really top names in the field come on board, which has been amazing. And they're doing innovative scholarship. A lot of these topics, no one has done a talk on this topic. Mm-hmm. We had a workshop talk on victims of anti-white racial aggression. I don't know of that being done anywhere. We'll have an article in our next journal on the topic, and we found that a PsycInfo search for anti-white aggression for that phrase yields 0 results. So it's like, usually you think you only have a few dozen articles. That's a gap in the literature. But to really have 0 results for a lot of these terms. Same for, we did really interesting talks on authoritarian personality structure in society, on the question of self-censorship, who's self-censoring and why, how does it interact with other symptoms, how does it come up in therapy, how do you treat it? There's so many questions. And I think in each case, we had somebody who's like a really brilliant mind in the field, thinking in an innovative, creative way to come up with novel, useful insights about real things people are struggling with. Masculinity is kind of a very on topic now in society about what's a way that men can feel masculine in a way that feels positive and authentic and real. It has to really be it has to be sincere, and not and positive and valued. And I think we're really struggling with this in society, and we're not aware of anti-male biases that come on. And I think there's quite a few of them.
Hmm.
So just going through issue after issue, we're really prioritizing articles and talks that are succinct and full of novel insights and useful from top scholars. So I think it's incredibly good, incredibly clinically useful content. Sometimes people say, "Oh, how much?" Maybe this doesn't happen as much, but when I started with Open Therapy Institute, people would be like, "How much do politics even really come up in session?" I think it's a lot. I people are getting divorced over these issues and losing getting estranged from family members, losing friendships, moving cities, losing jobs, shifting careers. This is huge. This is affecting every corner of people's lives. If none of your patients are talking to you about politics, maybe that's something to think about asking about, because it's probably on their mind, at least from time to time. How could you not be impacted by it? And I think it often gets tied up in whatever the symptoms are, the depression, the anxiety. It gets wrapped up around these concerns. So that's why really being aware of these like the perspectives that we're offering and the insights are just going to be, I think, clinical gold for people as they see this stuff come up, and they're going to be more knowledgeable and more skilled on all these areas. These patients are, a lot of them I think have dropped out. They're not even looking for a therapist. They're disillusioned from the field. They don't trust the profession anymore. And so, but there are millions and millions of them, and maybe they're skeptical of therapy, or maybe they're not even looking, even though they could benefit. It's a great way to grow a practice. I think a lot of times people in the field think, "Oh, well, I wouldn't want to serve one of these populations because it would hurt my practice. I'd be outed as something, and then I wouldn't get referrals." And I actually think that if enough people come together, it'll really be a different. You'll be the most in demand, because there's no therapist doing this, and you'll be the best in the country at your specialty, and it's low hanging fruit, and you'll serve a lot of people and do a lot of good helping people. But we need to kind of get the literature and the training going, get the juices flowing, so that people can think about how to develop this. Ideally, our members will all become leaders in different specialties and subspecialties in their area of the country, and have thriving practices and contribute intellectually. And we really want that kind of community.
Yeah. So some of the overlooked issues in mental health care include political stresses, self-censorship, masculinity issues, anti-white aggression, a few of the things that we've already talked about. From a past to present perspective, how do you think we got here? Were these overlooked issues in mental health care, were they intentional along the way, or would you say that they just happened unintentionally?
Yeah, I think some of them are broader cultural blind spots that we've kind of have emerged throughout the culture. A lot of them are broad cultural blind spots. Some of them are issues that people know are issues, and they are afraid to talk about. Um, and some of it has to do with bias in academia. So I really think it's the full spectrum of things. It's always interesting to me what people are nervous to write about and what they're not nervous to write about. It's a lot of people are comfortable writing really angry stuff, which is always interesting to me, because I would kind of be like, well, I wouldn't feel comfortable publishing something with that amount of aggression in it. But people are comfortable with that. But then writing a non-aggressive article on, like, a racial topic, for example, that's not hateful, no one wants to touch it. And the big issue is I've heard lots of cases of people describe being bullied for being white in school. It's a story that I've heard a lot. When you open yourself up to hearing those stories, it's not so rare, and no one will write about it. I mean, I just can't get one person to write about it, and it's disappointing. We do have an article coming in our next issue. It's the first one that we've had, but it's been really, really hard. And I think often when people do write about that topic, it's interesting because they'll write something very angry, which is not something that we would publish. It has to be very careful and positive and clinically focused and constructive. But it's an important topic to discuss. And with a lot of these issues, and I think our authors and our faculty are really superb in this respect, but it's hard to find these people, and it's hard to cultivate the group that we have, which is one reason I'm so proud of it. But it's to have people who are courageous enough to write about these topics, but careful enough to not do it in a non-constructive way. That's a challenge.
How do you navigate a conversation with someone who sees this as an opportunity to really say, well, I've been oppressed so long, these issues have not been covered. So,
Yeah.
intellectuals are emotional too. And someone might have an emotional response and say, yes, finally I have the opportunity to say what I've been wanting to say. And
Yeah.
how do you help them, reel it back and say, this is still an intellectual forum?
Yeah. You try to just focus always on patients. How do we help patients? Every article is going to be, this is a patient population. What's clinically helpful for them? I don't want to hear an op-ed about whatever. It's just tell me something useful about how to help this population in a constructive way. And the truth is, anger may be part of their process of having that experience, and that would be understandable. It's not going to be the end point, because that's not a very satisfying life. And so you kind of, at some point, you have, I would expect all the stages of grief, denial, anger, bargaining, whatever, you expect all of that to happen as they go through their process. But if you're stuck on any one of those phases, it's not, I wouldn't consider that a successful treatment. So that's what we try to do. And we do have clear style guidelines for the authors, which we hold to. But in the broader culture, it's the same thing. People often don't express the real source of their frustration. They'll pick a symbolic issue or a side issue and fight about that. Those issues, I think, tend to be very volatile, because you're not talking about what you're talking about. You're talking about, it's the national anthem, and there's this kind of other meanings that are all behind it that are being fought over, and often they're not expressed directly. It's the same thing that you see in like a couples or family session where they're fighting about, you left the sponge in the sink, and it's really actually about the fact that you had an affair. And that's what we have, like, I think writ large. Like, it's kind of like, maybe let's talk about the affair, and we can fight about the sponge later if that's still an issue.
Yeah, that makes perfect sense. Matt, I know you haven't gotten a chance to speak.
Yeah. No, this is very fascinating, Andrew. Thank you so much for sharing.
Yeah.
There are some certain parallels that we're seeing in our organization and the evolution and so forth, and similar populations. One of the individuals that I was working with when we got started several years ago now has a practice serving gun owners, and another faculty member, we were working on a book project. Her husband is a law enforcement officer, and just going to work and hearing at that point in time all these disparaging comments about law enforcement officers and so forth. It's just interesting, because the more that there's kind of that aggressive tone towards any population, you're likely to have family, friends, colleagues, associates from those different populations, unless our interest in being pro-social,
Yes.
rather than trying to talk down someone or be anti anything.
I would just piggyback on that. I mean, the situation is that the issues that are impacting people the most, and that they're most emotionally dysregulated about and having the hardest time talking about, are the exact same issues that you would be expecting therapists to be most likely to mishandle related to politics. So like a police debate is something that a patient could be really sensitive and feel very personal about. And that's the type of issue that in the state of the field, especially right now, I would be most expecting a therapist to mishandle. I had a supervisor when I was in grad school who was proud that she had a Black patient who was married to a cop and thought the police were being demonized unfairly. And the therapist said that's internalized racism, and lectured the white therapist said that's this internalized racism and lectured her about it, and was bragging to the group about how she was going to make progress with this person and her internalized racism on this issue. So the same issue that the patient might be feeling in a really poignant way is the exact thing that therapists are most likely to mishandle, which is why if you can make a practice for yourself as being somebody who's trusted with one of these populations as getting it, you can really have a great practice and maybe even write some about it and make a contribution to the field more broadly.
Right. And that kind of leads to a question is, as I was looking at the overlooked issues in mental health care, which I really appreciated that, Andrew. I thought that is very well done. For our listeners, you can find it on opentherapyinstitute.org. It's a great drawing here or reflection. I wanted to just ask you a little bit, because as I was looking at that was precisely my question. Just trying to counterpoint, think in my mind, okay, what would the dialogue look like here? Some might look at those things and say that, this, the way that you're describing it here, how do we know that this is not, if we have a political conflict in families and couples, or some of the things that are described, in the race issue that, let's see if I can find it here, that people of color who disagree with dominant anti-racist narratives and how the racial schema impacts culture of people and their mental health. How do we know that that's not internalized, racism? How do we know that those who may have different thoughts about gender roles, and how do you know? How would you differentiate that, or clarify, or respond to that?
I definitely think that there are challenging issues. I mean, I wrote in the Wall Street Journal about treating a white patient who hated white people, and I think that's an important, an important issue. Now, one person might look at that and think that's their legitimate political opinion, and I should honor that. And somebody else might say that's pathological. It's the self-hatred. It's not healthy, and you should weigh in on it. So I definitely think there are really challenging issues. I tend to try to stay patient-centered, try to stay on the patient's goals. I don't know that there's a one-size-fits-all answer to these controversies. It's good to be entertaining that there could be different approaches that could be effective on these. I think in a lot of my training, I think that even broaching that any of these could be a question in the first place would have been unacceptable or very risky. I think people would have been terrified to speak about this. But a lot of what you see in the actual bias that impacts sessions is not, I think there is the room for we have a slightly different perspective on something, or it's a very tricky charged issue and it's complicated. A lot of bias is you don't ask about it. You find out they're conservative, and then you avoid politics every other time it comes up. You assume the male is more aggressive from the get-go in the couples therapy session. It's a lot of it is not so subtle. You having explicit politicized messaging throughout your office, interrupting the patient to tell them you don't like their politics. It's there's a lot of stuff that's happening that's it's not somebody who really understands everything in the room, and they're trying their best to formulate it with the patient, and they just happen to get it wrong. I have a lot of grace for that. But a lot of the bias that you see isn't that.
So could I Can I offer maybe a response to my own question and invite you both
Okay.
to kind of poke holes in how
Okay.
I might respond to that? Because I did have that conversation in my mind. I was interested in your thoughts, but if somebody has an internalized sense of not feminism, but patriarchy or internalized racism or those kinds of terms that are commonly used nowadays. Where I might go with that is to address that in the context of self-determination. And every client is going to have their own goals, regardless of their gender, their gender identity, their sex, their sexuality, their race, their different characteristics. There are different beliefs, different values, and my role is not necessarily to indoctrinate or tell them what is right and wrong, but to help them identify and clarify what it is that they're willing to pay a price for. And sometimes to make sense and meaning of the price that they're paying for and the suffering that they actually experience in pursuit of their self-determined, own values, if you will. And who am I to say that that any of their values are right or wrong or rooted in whatever pathology we're at in the sociopolitical zeitgeist that we're in the middle of. That's just one way that I might look at that, is honor self-determination, honor diversity in how, and if somebody is seeing you because they have lots of anger towards white people and they want to address that in therapy, you help them address that in therapy. That is their goal. If they have feelings that or thoughts, feelings, behaviors that they're struggling with, you help them with that particular goal. Does that fit? Does that
yeah, I mean, I think for me, like I would agree with that, and it's definitely a stance to take, and so I think it's the appropriate stance. I think the issue with like take an issue like religion, like it can interact with how you experience anxiety. Is that a coping skill that you use when you're anxious? Is you pray? Or do you think about God when you're anxious? A lot of people who are religious think they're not supposed to talk about that in session. And if you don't ask about it, I think in the intake, for example, there are things that you can do to communicate that you don't want to talk about it. You can be kind of awkward and flat-footed. You can change the subject. You can avoid it. And you can just fail to ask about it, even though it could be an important part of somebody's life. So even within that instance, the therapist could think they're being very patient-centered and very goal, and even be like a good therapist and just have a blind spot of like, hey, most of the country believes in God. It's a large majority. There's a lot of religious people in the country. Probably you have more patients who are religious than you think. The field skews more agnostic, secular, but you should probably learn something about it, be comfortable talking about it, and ask about it. And so that's not necessarily that the therapist is explicitly biased or imposing agenda. It's just a blind spot. And you could see a similar thing happening with like, biases against men, and just not even recognizing that you're reading them as more aggressive or less sympathetic or whatever it might be. And need to hear that just to kind of like see the things you're missing. So I think you're right in general principles, but I think I was just saying it's just that the question of bias is like a much broader conversation.
Right. So go with that a little bit. You were talking about, we want to be more than slogans.
Yeah.
We want to be more than just these trite, don't be biased. Well, yeah. It's always easy to tell you what not to do. But what is it that we're for? If we're trying to move away from bias, what would you say you're the Open Therapy Institute, or that you're encouraging these professionals to move towards? What does that look like?
Maybe the positive way of framing it. I mean, I don't, I don't love this term because of, I think, of what it's become. But one way of thinking about it is cultural competence involves sociopolitical values. That's something that Richard Redding, our research director, has written about for a long time, and it's been a big influence on me. So, real cultural competency means skill with diverse sociopolitical values, and that includes religion and politics and other social values. So, what we're trying to do is build skill working with diverse sociopolitical values. And it's really, I think, the missing piece of cultural competency. And it's not a small part of cultural competency. It's a huge part of what culture actually means and how it's actually felt by people. And a lot of the way that it's currently framed, cultural competency usually is kind of merged with DEI in a lot of ways. And it's, race, gender, sexual orientation, immigration status, it's things like that. It's very left-coded identity categories. And nothing, and I mean, I'm sure it's different everywhere, but often little to nothing on religion, on any of the sociopolitical issues that we're talking about.
I feel like it's in the name, right? Open Therapy Institute. So it's prioritizing openness to different ideas and ideologies, and welcoming all of it into that therapeutic space. I also think it's really valuable because, as being on the education side, I consider written work, peer-reviewed work, and op-eds as well, popular press work, as intellectual artifacts that reinforce those who are consuming those artifacts, readers, students, future therapists, future social workers, future psychologists, future psychiatrists. And so a lack of literature, both peer-reviewed and popular press, helps to reinforce in a different direction, reinforce in somewhat of a closed direction, in that this is what therapy is. Because when I look up, for example, anti-white bias, I find no articles, as you mentioned. 12, as you mentioned, would be a gap in literature. What does 0 mean, right? And so you're reinforced into going in the direction of bias cannot exist in the anti-white direction. And whether consciously or subconsciously, the student gets their bachelor's degree, their master's degree, their PhD, figuring subconsciously that this is what therapy must be. And before you know it, they got a PhD or a master's on their title, and now they're considered an expert in the field. And sometimes they might not even know that they're practicing in a biased way, perhaps not through any fault of their own, but because they've been reinforced covertly in a particular direction.
Yes. Yeah. And and I think that's exactly it. That there's just especially among younger therapists, just like they haven't thought about this stuff, they haven't been exposed to it, and I think that's why writing one article or one talk on the issue and just having one thing out there is such a big step. Going from 0 to 1 is such a hard step, and it's really amazing when you look at the journal. Our next one will come out September 1st. When you look at our workshop programs, and we have a couple in the fall, or our last journal, which came out about 6 months ago. Every talk, every article is a 0 to 1. Like they're all filling a huge gap and doing something really novel and interesting. And so, I just think they're really, and they're fascinating, and they're often issues that really impact a lot of people. So,
yeah, and I think those who are watching, those who are listening, you're encouraged to go on Open Therapy Institute's website and fill out the link if you have an idea for an article, because it's true, from 0 to 1, you are essentially the pioneer of that particular perspective. It's great for someone's career, certainly, but more importantly, it's great for what exists in that environment. So this way you're creating an intellectual artifact that can get cited in the future and really be the basement floor, the first floor that builds us, hopefully what ends up being a skyscraper.
And I would say another thing, like in terms of, I'm not sure how much your audience is professionals. I'm guessing maybe a lot of them.
Yeah.
But really, becoming a member at OTI is so helpful to us because you get access to peer consultation groups and discounts and clinical referrals. We have regular clinical referrals we share with our members. But when you're a member, it gives a communication that there are people in the field who want to do this work, and it opens up opportunities to really have a force. We have to come together.
Yeah.
I think it's all about finding ways to come together. And I think, it's interesting thinking about pro-social workers. I mean, I'd love to talk to you. Maybe the podcast isn't the best forum, but or maybe it is, but we have to find a way with the different institutions. There's a need for lots of institutions because there's a lot of stuff that's needed. We need training placements. People often ask for rankings of which programs are more or less ideologically one-sided. There's in some instances, there's need for reform of ethics codes or curriculum. There's need to do research on new topics. There's need for clinical services for patient populations everywhere. So there's lots of stuff that needs to be built, and Open Therapy Institute really can't do all of it. So it's interesting, but I think we want to find a way to have organizations that are as complementary as possible. And because if we duplicate each other's work, we end up kind of being dividing and being competitive. And when we complement, we are mutually enhancing, and it sets up partnerships. So I think a big challenge or opportunity is to think about this new ecosystem that's emerging, about how do we get people in different spaces forming complementary functions that really enhance each other, as opposed to duplicating the same work in the same space with, because then it really doesn't work. But we want to find a way, going back to how people can get involved, we want to find a way to set up these organizations, to not just among the organizations, but among the members and the professionals who sign up, that they can feel the same way. And one of the things about having lots of overlooked issues that people can say, well, I'm really good at dealing with anti-Semitism, or I'm really good at dealing with self-censorship issues, or I'm really good at this, and that we can have that ecosystem where, look, people are licensed in different states and they live in different cities. And it's like, if we really had a specialist in each one of those areas on that chart in each of the states, we'd have 20,000 members, each having a complementary function that was mutually. So I think we wanted to foster something where we're all just helping each other thrive in these and filling these gaps that have been open for too long.
That's great. And we'll list on our website under About Us, who are partners and people who have similar interests. We have, our heterodox social work group on there. We'll add OTI on there, so people can find and appreciate your interest in sharing and giving our participants a discount as well. So that's a lot of good things. And as we looked at that, there are some similar things that we do. Obviously, we do a lot of continuing education and so forth. And one of the things that we're accredited to do is to offer continuing education for written articles and so forth. And so we'll talk a little bit about how we can offer continuing education for your journal and what that looks like. And I think that's one way that we might be able to share some interest.
Oh, that's
would that be okay if we
explore that?
Yeah. That'd be great. So moving towards kind of away from bias, but towards this openness, this open stance, the
I would still,
curiosity.
yeah,
Yeah,
I would
yeah,
say it's like we could say openness, but it's really, in some ways, it's more like skill with,
yeah.
it's
So
also
describe
built
those skills a
into,
little bit more. Yeah,
yeah.
what are those skills? What does that look like?
A lot of it is just awareness of the experiences that people have. Like, I mean, I remember I had a colleague, who was a therapist, and I remember talking about people who self-censor and like how hard that can be, and it can be very isolating, and they don't know what they can say when, and there's often a lot of anxiety and pessimism, um, and his response was, well, what do they want to say that they feel like they can't? And it really, there's something about asking that question that really made me recognize, like, oh, this person like does not get it at all. I was kind of like, he has no sense of exactly the different fears and concerns that can come up for somebody who might have an innocuous view. Maybe they think there should be less immigration, or or even they were concerned about the COVID lockdowns, but they don't want to say anything because they'll be branded as a conservative or a Trumper, and then they think people will, even if they don't lose their friends, there's a lot of stigma that can hang over them, and it can work away at a relationship over time. People kind of know the different risks. It's not always that you're going to get fired, but it's just kind of like the workplace is now less fun. It's more awkward. You can feel judgments, but just, he needed all that explained. Is that really, would people really do that? It's like, yes, they do that, but it's like, and I think he kind of knew it, but he just didn't know. And so I think, back to your question about what does skill look like, a big part of it is just awareness of what people are experiencing and what they're going through. And then thinking about, okay, so if he is self-censoring, what's helpful? Not to get too stuck in it. There is a acceptance change dialectic where you want to think about, there is acknowledging a real challenge here that needs to happen. But if you don't help a little bit with thinking about how things could go differently, I think you're not doing your job as a therapist. And often there are more ways to speak up and connect to people than people realize. And sometimes they need help practicing and thinking and trying things out gradually. But so I think there's a lot of just like, once you've had the conversation and read some articles and got the juices flowing about it, I think people have a lot more comfort. But if it's totally off their radar, I think that's when they tend to be less skilled.
Yeah, I think that one of the functions of your journal is that it's building awareness of worldviews that exist in our neighborhood, but just because they have, whether intentionally or unintentionally, been suppressed, many of us don't realize that those worldviews do exist. So folks who think like, oh, what do they want to say that they can't say? That idea is reinforced when you go to Google Scholar and you look for certain articles and they don't exist. So you think that that perspective doesn't exist. Nothing could be further from the truth, of course, but it helps us understand that. We appreciate your journal so much for that reason, for many other reasons too, but for specifically that reason, because it opens our eyes to things that have been in front of us. We just haven't had the ability to see them until now.
Thanks. Yeah, yeah, and it parallels all the other forms of bias that people have tried to address. Where there've been blind spots, and for one reason or another, and just having that, just hearing some case studies of what happened. Here's an interesting thing that happens a lot of times when people face like an online barrage of criticism for something they said, or their peers start really going after them for something they said. A lot of people experience this extremely strong pull to apologize, even when they don't think what they did was wrong. I think that's so interesting about the power of the crowd you feel like everyone's coming at you, and there's this, I don't know, some kind of evolutionary or whatever thing to just be like, I was wrong, I'm bad, I'm, even if that's not what you believe. So the more we can understand what do people experience when they're antagonized that way, how much do they internalize it, how much do they cave? I think a lot of people aren't self-censoring, they're repressing. They don't let it reach their consciousness, because a thought that's too dangerous to say for a lot of people is too dangerous to think. And so you get, as it gets more and more repressed, you can get stranger defense mechanisms, more primitive defense mechanisms, more borderline defense mechanisms. So there's a lot to unpack, but I think if we're more aware of these processes and thinking about them, we'll be more comfortable and open and engaged with all.
I really like that if bias is rooted in unawareness or lack of awareness or ignorance, that just becoming aware, seeking awareness, seeking, being open, being curious, kind of that cultural or intellectual humility, willingness to explore diverse viewpoints, diverse perspectives. And I mean, that's a very common, cognitive approach, is perspective taking, and being able to look at your own experience or your own, processes in different ways. And so it's not just internal. It doesn't just do us good internally. It does us good externally and in relationally with others throughout the world. And I really appreciate that in what you're describing there.
Yeah, and I know we need to wrap up soon, but one issue that really hits the nerve is listing pronouns in your bio or email signature or other places. That is a really important issue. It just in terms of symbolism, but it does communicate exactly what you're saying about perspective taking. Most people, in my experience, who list their pronouns, why are they doing it? They're doing it to be inclusive. They think maybe somebody's trans or knows somebody's trans or is concerned about this. By listing my pronouns, I'm signaling inclusivity. What they're not aware of is, what if they detransitioned or know someone who detransitioned or know somebody who has religious beliefs or had a number of other experiences that might not have been good with this movement. They're a female athlete or whatever. You're signaling to them that maybe you don't share their views, and there's an exclusion that can be communicated. So when people think about, do I list my pronouns, don't I, that ability to take the perspective of there being valid views on both sides of how this might be read, that is very rare. I mean, I know in New York, the most people, large majority, list their pronouns, and most of them can't conceive of why anyone would have a problem with that. Yeah. And so that just underscores this total inability to take the perspective of other people.
Yeah. So last question for you, with time running out.
Okay. I got more. Hang in there, man, will you?
Okay.
So the year is 2030. Open Therapy Institute has been successful in everything that they wanted to be successful in. So 5 years from now, what does that success look like?
Oh man, what would I like? Well, I looked at Bureau of Labor Statistics, and mental health professions, psychiatrists, psychiatric nurses, social workers, all the counseling professions, marriage and family therapists, mental health counselors, psychologists. Altogether, it's probably about 1.5 million Americans just in the US. And surveys tend to say about 10% of those professions are conservative. And there's probably another 20% or so that are heterodox. Otherwise, they're concerned about bias. They're center left or centrist, moderate, libertarian, something like that. So I think it's probably about a third. I think it's probably about 500,000. There are probably about 500,000 mental health professionals in the United States who are, to some extent or another, concerned about bias. Now, if Open Therapy Institute could get 1% of those people, we'd have 5,000 members. It would be such a different place from where we are now, where we have few hundred, couple hundred members. So 5,000, that would be huge. But if we had 10% and we had 50,000 members, we are a really forceful national organization. And we could have training placements. We could be shaping curricula for programs. We could be shaping legislation. We could be building all kinds of resources in this space for anybody who wants it. So, hitting that mark would be so pivotal in terms of all the things we could create, different conferences, different divisions focused on different issues. All of that would be, so I think I'd love to have, here's another ambitious goal. Our journal, well, maybe I shouldn't weigh in on this. I think our journal is not as widely read as we like. We have some hopes that of getting it distributed more prominently. If it's open source, it's not behind a paywall, the articles are accessible and interesting and useful. And I think it can get more read and more cited than top journals in clinical psychology, because those journals are just, everything comes out years after it was relevant, and it's a long, tedious article that people can't read and don't want to read, and it's behind a paywall. And I just think our ability to influence the discourse with a different type of journal is immense. But I would like to do all of those things that I listed. Ideally, I think our big hope is that the membership grows and that people take the classes we have and we can offer more. We'd love to do a certificate program, but we want people to take we have a whole slate of workshops on demand. People can take whenever they want. We have live workshops coming up in the fall and all the membership activities. So the more people we can get involved, the better.
That's great.
Yeah.
Yeah, we certainly, have some shared interests and some complementary, things that we do. But certainly our approach is quite similar. That our content is, is free. You only pay for your continuing education credits, and there's a number of things. And so we're trying to take. I see a lot of pro-social in what OTI is trying to do. So thank you.
We do charge. So the membership is $99 for the year. I've talked with people about different ideas, like, oh, you should make it free. You should make it $5. You should do this. We've entertained all these different options. I think it really means something when we show people that have some type of commitment. It's not a lot. You'll get a referral most likely out of it.
Yeah.
It'll pay for itself. So it really does pay for itself. But most people, and some people get a lot. So, but I think that showing that you're a professional who's engaged, and it does kind of screen out trolls and other things like that you have to pay to get in. And so I think there's a lot of kind of functions that fee serves.
Yeah. But just your journal, the journal's
free. Yeah.
Exactly. That content is free. It's very good. Yes. It's really good content. So
thanks.
So I really appreciated that. So Andrew, if you were to look at this, this chart that you've got here of the overlooked issues, could you tell us maybe one that maybe one that's your area of expertise, or one that you've kind of addressed, and describe that a little bit about how you...
Oh, that's interesting. I really am involved in all of the topics in some way or another.
Could you describe maybe a case or a situation and how you approached it? Without breaching confidentiality. Maybe you would just have to kind of hypothetically amalgamate.
Clinically, something that I've worked with clinically on my own that that's interesting. Just for the record, so that people know, to work on Open Therapy Institute, I drastically reduced my practice, so I only see a couple.
Okay, very good.
Currently, so it's smaller. But I'm thinking of a couple examples. One thing that I've written a lot about is dialectical thinking, the ability to think about positives and negatives about the same thing at the same time. I think that's so related to political dysregulation, like emotion dysregulation related to politics. The reason people can't talk to each other is not, maybe this shows my kind of like dynamic or DBT way of viewing things. I don't think the reason people don't talk to each other is a cognitive thing all the time, like a belief that I shouldn't talk to you. I think it's often as much an emotion dysregulation issue. There's a really great scholar at Heterodox Academy, and I'm blanking on her name, whose work is in this area. And I think she hit the nail on the head, where it's people can't regulate their emotions around each other. And I think the key to the emotion regulation is ambivalence, cultivating the capacity for ambivalence and dialectical thinking, which is poor. And so I created a worksheet for Heterodox Academy that was like a classroom exercise to develop dialectical thinking. And it's just pick an issue, pick 3 pros, 3 cons, and something you're unsure about. That's it. And then just be with that. And it's like people feel it in their body.
Yeah.
How uncomfortable that is. But also that discomfort in a way is medicine.
Yeah.
And so I think a lot of when you're like, how do you diffuse political conflict? A lot of it is get in that dialectical space and get comfortable with it.
That's great. That's great. Dialectics are there's a lot of power in that. So certainly appreciate that. As part of pluralism, is just being able to be comfortable with the discomfort around others who are different. So thank you. Nafees, anything else?
No, Andrew, I want to thank you again for joining us. It's been a wonderful conversation. We'll certainly send you the link once this goes live. And once again, this is Andrew Hartz, Open Therapy Institute, joining us for our Pro-Social podcast. Thank you again, Andrew.
Thanks for having me.
One last question for you, Andrew.
Oh, okay.
Just for what does it mean to be pro-social?
To me?
Yep.
Oh, I'm sure it has like a good textbook definition.
No. We don't want that. We want you. We want your take on it. For you, what does pro-social mean to you?
I think it's active engagement to cultivate, positive interactions with other people.
Great. It's a great way to describe it. And we really like what you're doing with OTI. It's very pro-social.
Thanks so much. And I'm really excited to learn more about pro-social workers and work with you more in the future.
Yeah. We'll be in touch. We certainly will.
Thank you for listening. Please consider donating to the Institute for Liberal Values, a 501c3 nonprofit organization at ilvalues.org. All donations go to support our continued programming to realize our mission to provide the skills and support required to build community where there has been division, to encourage free expression where there has been censorship, and to foster optimism where there is fear.